My name is Nigel Sparks. I am a orthopedic sports medicine physician here at Virginia Mason downtown. We specialize in soft tissue orthopedic injuries such as tendon injuries, ligament injuries, cartilage damage, sort of the soft tissue injuries around the bones. Really overuse and underuse injuries. So tendonitis, tendon ruptures, ligament injuries, cartilage damage, really soft tissue injuries around the bones. That involves orthopedics. Yeah, my main focus is really knee and shoulder injuries. That makes up the majority of my practice. I have a huge interest in cartilage regeneration surgeries right now. It tends to be a hot topic. So I do have a focus on that, but most of the things I take care of are tendon ruptures in the shoulder and ligament injuries in the knee. If you look at society today, I think technology is a exciting area. Things are moving along very fast. So medicine sort of follows that. But definitely with the way technology goes, I think, our advances allow us to treat injuries faster, get patients out of the hospital faster, get them back on their feet faster. I think I got into orthopedics because of the satisfaction of actually taking a patient who is really struggling with daily activities, and then at the end of their treatment, knowing that they can get back to doing everything that they were doing before. There's, it's satisfying work. All the time. Soft tissue injuries are a little bit different than fractures in the sense that 50%, of getting better is not so much the surgery, but how you handle the recovery part of it. How you do with the rehabilitation, whether that's mental or whether that's physical. And it's amazing to me how much patients can push through a problem, even when they don't want to, or they don't know that they can. But that the satisfying part of that is seeing them take that struggle and turn that struggle into an accomplishment. When I interviewed with Virginia Mason, just the camaraderie of the physicians, everybody has the same one-minded goal, which is to make the patient better. So the patient, you think it's, people just say it, but they're not. I think they really mean it, and the patient definitely is at the top of that pyramid, and you don't find that everywhere. So through my interview process with Virginia Mason, I think the bright point of it was seeing everybody say the exact same thing. We're here to treat the patient and make the patient better. Over the last 15 years, sort of developed a system or an understanding that everybody has a story. So for me, taking that patient's problem, which I know can become a good story or a bad story, and helping them through the problem. At the end of it, it's nice when the outcome is good, and the patient looks back and they say, oh well, this has not been what people have told me it was going to be. This is not the struggle that I thought it was going to be, and the smile that people have when they recover from their injuries and their problems really is satisfying. Orthopedic sports medicine is one of those fields that requires more than just my care. Most soft tissue injuries do require physical therapy or rehab. And it's, the difficult part about having an orthopedic problem is that it can affect things that you do on a daily basis, whether it's, washing your hands, eating, walking, besides the exercise stuff. So it really does involve myself, the physical therapist for helping that patient get better, and obviously that patient's family members to help them through this process. I just fell in love with the culture. I think, there's nothing better than being at a place where you feel valued, where you know what you value is the same as what everyone else values. And I think for the most part, the majority of us get into medicine because we really want to make people better. We want to treat patients. I think here, through the interview process, I felt that I could do what I love to do, which is treat patients, make them better, and still be involved in team sports. I like the story part. I like listening to what brought them into the office, how they developed their injury or their problem, and then making sure that I become a part of that story in a good way. So when I'm not doing that, I do like to spend time with my family. We have 3 kids and who are active, so we like to spend time outside. I did spend a lot of time growing up around sports, playing video games and being involved in computer stuff. So when I stopped playing, sort of gravitated towards building gaming computers and, just being involved in that hobby. So my wife and my kids like to do that too. So we do have a game night at home where we try to get together, and rather than playing board games, we play video games and just being around the family and watching them grow.